learners, today we are going to continue the second part of diseases of nose, and in last class we had discussed regarding CSF up to CSF rhinorrhea, and today we are going to discuss with the topic epistaxis, which is also known as nose bleeding. So here most common cause in case of children it is nose picking, we can see in RM trifilum, and in case of adult it is because of hypertension. So before getting in detail, we should know something regarding the septal anatomy, where this bleeding arises and everything. Okay. So first let us start septal anatomy. So first, the most common area is Little's area. You might be knowing it. And there are few different names for this. Kissel, Bax area, or Kissel plexus we can say. And then locus valsalvae plexus. So here where it is located, that is the most important point. It is located in the antero-inferior part of the septum. Okay, in the septal wall it is located. Antero-inferior part of the septum. So here this antero-inferior part of the septum is supplied by both the external branches of external carotid artery and internal carotid artery. Okay. So whenever there is problem or leakage or damage to these arteries, that will lead to nose bleeding. So here the branches which were formed by both the ICA and ECA were easily remembered as legs. So first one is superior labial artery. So L for superior labial artery, then E for anterior ethmoid artery. So here E. Then comes third one, that is G. G for greater palatine artery, and S for sphenopalatine artery. So these branches are mainly supplying the Little's area or Kisselbach's plexus, and here there is a special name for this sphenopalatine artery, that is, it is also called as artery of epistaxis. It is also called as artery of epistaxis. And here what is more important in case of Little's area? So this is the most common area of bleeding in case of children and young adults. Okay. So the causation is nosebleed. And just imagine that the children are always picking the nose in the antero-inferior part of the septum, leading to breakage of these arteries which were formed by the union of external carotid artery and internal carotid artery, and the arteries branches were LEGES, superior labial artery, anterior ethmoidal artery, and G for greater palatine artery, and S for sphenopalatine artery. And this sphenopalatine artery is also known as artery of epistaxis. Okay. So this is regarding the Little's area, and few more areas related to the epistaxis we should know. So the second area which you should know is regarding retrocolumnar vein. How this vein is contributing. Okay, so here it is the common source of bleeding. Common source of bleeding in case of mainly venous bleeding in young people. Okay. Then comes the third area or plexus, that is Woodruff's plexus. So here regarding Woodruff plexus, it is found in the lateral nasal wall. Lateral nasal valve, it is there. So location is more than enough regarding this. Then comes at last Brown's area. So here in case of Brown's area, what we should know, it is located in the posterior part of nasal septum. It is located in the posterior part of nasal septum and it is the common cause of posterior epistaxis. Common cause of posterior epistaxis. So, regarding retrocolumnar vein, it is the common source of venous bleeding in young people. And Woodruff's area, it is located in the lateral nasal wall, and Brown's area, it is located in the posterior part of nasal septum, and it is the common cause of posterior epistaxis. Okay, so this is regarding the septal anatomy, which we should know. And now moving on to the next topic. That is MCQs related to fracture. First, here before entering, first most common fracture is seen in clavicle. Second most common fracture is seen in wrist. And third most common fracture is seen in nasal bone. Okay. Then most common site of mandibular fracture, mandible fracture. The most common site is subcondylar region. So, most common mandible fracture is subcondylar region. Okay. Then, in case of orbital floor fracture, what happens? There will be a blowout, like all the structures used to blow out through the orbiter, leading to appearance of teardrop sign. It used to appear like this. If we are doing CT or X-ray, that time because of the orbital floor fracture, we can see this teardrop sign. Okay. And next comes the fourth point. Most common cause of oroantral fistula. So the most common cause of oroantral fistula is extraction of upper first molar, leading to the most common cause of oroantral fistula. Okay. So first most common clavicle, most common, second most common is wrist fracture, and third most common is nasal bone. And most common mandibular fracture is subcondylar region. And in case of orbital floor fracture, in case of X-ray and CT scan, we used to get one particular sign called as teardrop sign. And here the most common oroantral fistula is because of the extraction of upper first molar. Okay. So now we moving on to the next topic. Regarding inverted papilloma. It is also called as transitional cell papilloma, and it has few other names also. Schneiderian papilloma, Schneiderian papilloma, then Ringer's tumor. Okay, so these are all like other names of this inverted papilloma, and only few points to know regarding this. This is the most common benign tumor. This is the most common benign tumor of nasal cavity. Okay, then it arises from lateral wall of nose. It arises from the lateral wall of nose, and it is a pre-malignant lesion which may lead to squamous cell carcinoma. So this is all regarding the inverted papilloma, and sometimes the symptomatically it may present as unilateral epistaxis also. Okay. So first comes the inverted papilloma, transitional cell papilloma, or Schneiderian papilloma, Ringer's tumor. So here the most common benign tumor of nasal cavity, and it arises from the lateral wall of nose, and pre-malignant lesion is SCC, and here we may get epistaxis, unilateral epistaxis. So moving on to the next topic, doctors. So moving on, it is regarding the carcinoma of paranasal sinuses. Paranasal sinuses. So here only few MCQ points related to it. Most common type of carcinoma is squamous cell carcinoma, and most common carcinoma is arises from the maxillary sinus. Okay, most common carcinoma arises from maxillary sinus, and here you should know regarding this Ongren's line. Okay, so it is a theoretical line which connects the medial canthus of the eye to the angle of mandible. So based on this, the disease will be differentiated anterior inferior part and superior posterior part. So you should know regarding this line which connects the medial canthus of eye to angle of mandible. So this is regarding the carcinoma of PNS. Most common type of carcinoma is squamous cell carcinoma, and most common carcinoma arises from maxillary sinus. And what is Ongren's line, which connects the medial canthus of eye to the angle of mandible. So because of this line, the disease can be differentiated into two parts, so that we can have our identification, that is anterior inferior part and posterior superior part. So this is all regarding this Ongren's line. Moving on to the next topic. Next topic is nasopharyngeal carcinoma. The MCQ points related to it is most common site where it arises from. It arises from the fossa of Rosenmuller, which is in the lateral wall of nasopharynx. Okay. So the most common site is fossa of Rosenmuller, which is in the lateral wall of nasopharynx, and most common carcinoma is squamous cell carcinoma, and the common causation there is one virus associated with this nasopharyngeal carcinoma, which is more important MCQ, that is Epstein-Barr virus. And how here the presentation will be. So presentation, how the disease will be presenting, it will be presenting with upper neck swelling. It is because of the involvement of lymph nodes. So upper neck swelling will be there. Okay. And here most common distant metastasis is bone. So this is more important points related to nasopharyngeal carcinoma. Most common site is fossa frozen molar of lateral wall of nasopharynx, and most common carcinoma is squamous cell carcinoma, and the virus associated with this nasopharyngeal carcinoma is Epstein-Barr virus, and the presentation will be upper neck swelling because of the involvement of lymph nodes, and most common distant mets is bone. Okay. And here in this CA nasopharynx, one important syndrome has to be, triad, that is Trotter's triad, which is related to the nasopharynx. Trotter's triad. So here what it is, there will be palatal paralysis because of cranial nerve 10. Next, second, there will be conductive deafness. And there will be ipsilateral pain on side of face or mandibular pain will be there. And this is because of cranial nerve 5. Okay. So this is called as Trotter's triad, that is palatal paralysis, cranial nerve 10 involvement, conductive deafness, and ipsilateral pain on side of face or mandibular pain, that is cranial nerve 5. Okay. Okay. Next, moving on to the next topic, that is juvenile nasopharyngeal angiofibroma. So angiofibroma itself indicating it is a highly vascular tumor. So let's see the MCQ points related to this condition, that is juvenile nasopharyngeal angiofibroma, and it is the most common benign tumor and it is slow growing also. And it is a highly vascular tumor, as I told already. It is a highly vascular tumor and it is locally invasive also. And here the most common initial symptom is severe recurrent epistaxis. So this is all regarding it. And in case of X-ray of sinuses, one sign we will get that you have to remember. It is also called as antral sign or Holman-Miller sign. So that is bowing of, in case of X-ray, what we can say, bowing of posterior wall of maxillary sinus we can see. Okay. So here in case of juvenile nasopharyngeal angiofibroma, the most common is benign tumor, slow growing, and it is a highly vascular tumor and locally invasive. And most common is severe recurrent epistaxis will be there, the initial symptom. And in case of X-ray, we will get antral sign or Holman-Miller sign, where there will be bowing of posterior wall of maxillary sinus. Next, now we will be discussing mostly MCQ type of points only. So first, everyone know what it is. Anosmia. It is none other than loss of smell. Everyone knows that. In COVID, most of the people who had suffered had gone through these symptoms. Then cacosmia. Cacosmia is nothing but perception of bad smell. Perception of bad smell. Then parosmia. Parosmia is nothing but perverted perception of smell. Parosmia is perverted perception of smell. And phantasmia, even without any perception, like without anything which causes smell, the person used to have this perception of unpleasant smell. There will not be any reason. Even after that, there will be perception of unpleasant smell. And absence of disease, like there is no disease in the nose also. Nasal diseases or sinusal diseases will not be there. So this type of particular type of osmia is seen in temporal lobe epilepsy. So patients suffering from temporal lobe epilepsy, there won't be any diseases associated with nose or sinus, but they will be having the perception of unpleasant smell. So anosmia is loss of smell, cacosmia is perception of bad smell, parosmia is perverted perception of smell, and phantasmia is perception of unpleasant smell with absence of diseases in nose and sinuses, and it is mainly seen in temporal lobe epilepsy. So moving further, few terminologies which you should know. Rhinitis. This MCQ is related to rhinitis. So first, rhinitis medicamentosa. So here in case of medicamentosa, it is nothing but hypertrophy. Hypertrophic rhinitis will be there, and it is due to use of decongestive nasal drops. Like a lot of people, because of nasal obstruction, they used to use these type of nasal drops very frequently. So that may lead to this hypertrophic rhinitis, which is also called as rhinitis medicamentosa. Now moving on to the next condition, rhinophyma, which is also called as potato nose. So this is none other than the complication of acne or acne rosaceae. Other than the complication of acne rosaceae, what happens here? There will be hyperplasia of sebaceous tissues, leading to this type of condition. And rhinitis, sicca is always indicating dryness. So here what happens? It is mainly seen in people working under hard, dry and dusty surrounding. So because of this dusty surrounding, there will be crusting condition in the nose. Crusting condition will be inside. Okay. Then rhinitis caseosa. It is none other than the cheesy material drains into the nose from maxillary sinus. So this is all MCQs related to rhinitis. First is rhinitis medicamentosa. Because of the long-term usage of these decongestive nasal drops, it may lead to hypertrophic rhinitis. Then comes rhinophyma or potato nose, which is none other than the complication of acne rosacea. And here why there is swelling in the nose? It is because of the hyperplasia of sebaceous tissues. And rhinitis sicca, here it is a crusting condition in the nose where for people who mainly works in the dry, hot and dusty environments. Then comes rhinitis caseosa. It is none other than the cheesy material draining into the nose from maxillary sinus. And a few more conditions, named conditions related to this nose. First is Kallmann syndrome. You all might be knowing. So let's see what it is. So Kallmann syndrome, there will be anosmia, that is loss of smell. Then congenital hypogonadism. Congenital hypogonadism will be there. That is amenorrhea in female. Okay, Kallmann syndrome, that is anosmia, and congenital hypogonadism, that is amenorrhea in female. Then comes Samster triad. So what is here? So here in case of Samster triad, there will be asthma, there will be aspirin sensitivity, will be there. Then nasal or ethmoidal polyposis. Nasal or ethmoidal polyposis will be there. This is related to Samter triad. It is not Samster, it is Samter triad. And regarding Cart-Naegger syndrome, so here in case of Cart-Naegger syndrome, we will have recurrent sinusitis, bronchiectasis, and then at last situs inversus, that is dextrocardia will be seen. Most of the organs will be on different side, and it is because of the defect in dynein, due to dynein defect. Okay, that is leading to this Cart-Naegger syndrome. And here there will be infertility also. So in case of Cart-Naegger syndrome, there will be recurrent sinusitis, bronchitis, and then situs inversus and infertility we can see. And at last, what is Vidian neurectomy? What they are referring to? So this Vidian neurectomy we mainly do in vasomotor rhinitis. Vasomotor rhinitis. So these are all the MCQ points related to the diseases of nose. So in next class we will be continuing with the diseases of pharynx and larynx. So if you have any doubt, kindly communicate that to me. Thank you so much and happy learning with us.